Rottweiler Vlogs, episode 121. Mizzo and Mack out here at the Perry, Georgia Dog Show, visiting Dr. Nathan Craddock of Tiger Town Animal Hospital. This episode is going to be very informative, and if there was any episode that you want to sit back and take some notes on, this will be the one. As always, please like, share, and subscribe. Turn on your notifications bell so you stay up to date on all the uploads and you get it first. And I hope you guys enjoyed the video and appreciate the content. Thank you for watching.
Well, I grew up on a little farm in Gray Court, South Carolina. We always had a few pigs, we always had chickens, always had a few cattle, and always had dogs. And you can never really put your finger totally on when the light comes on, but as long as I could remember, it just seemed like a natural profession for me to go into was veterinary medicine. The animals always were more special to me than they were for the rest of my family. I always cried when it came time to have to slaughter, because on a farm you eat what you grow. And but we always had dogs, and the dogs were to me, I guess, more special than others. Always had some beagles, and we always went rabbit hunting, and we always had some bird dogs. Had Brittany's mostly, and that was back when there were actually some wild quail around. But hunting was always a part of my upbringing too, and using the dogs for their intended purpose with the hunting was important, and it still is important. I love watching rabbit dogs go, run rabbits and do their thing. I love watching a good bird dog at work. That's when we're at these shows, I'm always drawn to the sporting breeds and the hounds. There was one beagle that always stood out to me that I'll never forget, and her name was Cerise, which is French for cherry. And she was just one of the lead rabbit dogs. And when well, in those times most dogs kind of had a tragic ending anyway, and she ended up getting into a fight with a fox one night, and lost a fight with a fox late one night. So, but I always remember Cerise. That was
nice.
That was the best one. Like most boys, I guess, growing up, football was very important in my house. My dad was a scholarship football player when he was growing up, and so we always played football. Never really got into a lot of the other sports, just because in a small town like that there weren't really a whole lot of other opportunities. But the other thing that was important for us was scouts, and I've got 4 brothers, and 4 out of the 5 of us are Eagle Scouts, and so getting my Eagle Scout was also really important. So yeah, football and scouts were kind of the big things that we were into, and growing up on a farm, we worked hard, and when it was time to put up hay, buddy, it was time to put up hay, and we would not only work on our own stuff, but for our neighbors as well. And we heated our house with wood, so in the summertime was the time when we cut firewood and have enough firewood for the winter. So that was enough to keep a boy busy. So we spent a lot of time outside. We had lots and lots of woods around, and so we would hunt a lot. We would do a little bit of fishing and sports, and then stuck with Scouts. That was pretty much it. My first real veterinary experience was when I was in high school, and I started volunteering for a local animal hospital in Lawrence, and really enjoyed what I was exposed to there and what I was doing. And so when I went to Clemson for my undergraduate, before I even started classes, I went and found a job with one of the veterinarians in Seneca, and started working for them and learning more about what I was wanting to do along the way. So I worked for, I've been working for veterinarians in one capacity or another up until I finished vet school, and for 5 years after. But just working for other vets when I was in school. I also worked on the beef unit at the Clemson Ag Station. And when they ran out of money to fund student workers, ended up working on Danny Ford's farm there for about a year or so until I graduated Clemson. And of course, when you're in vet school, there's not really a whole lot of time to do a lot of work outside of school. But at that point, I knew that this was the path that I wanted to go on. And so you spend those 4 years basically concentrating on nothing but that. The biggest relief I've ever felt in my entire life, I think, was the day I received my final board scores. And I saw where I'd passed the boards. And at that point I knew that I would never ever have to take another test in my entire life. Mm-hmm. And so yeah, I think you get test fatigue after a while. And so when I passed those, that was a humongous relief. And pretty much the day after I graduated, I started working for Jim Mullican and Jerry Orr in Easley, South Carolina, and worked for them for about 5 years until I opened up my own practice in Clemson.
You and Mr. Lonnie Davis are the best of the best. I mean, just,
That's an honor.
Yes.
That's an honor.
And when I made my appointment with you to get Batman, Aqua Force Mack, my dog's hips and elbows done, mm-hmm. I had to wait a month, and when you want to wait for something that there's going to be quality, somebody who's going to give you great service, you're more than willing to do that. Right. How does it feel knowing that you have that reputation within not just the Rottweiler community, but the dog community, because you're very well known? That's why it's an honor to do this interview with you, and to be mentioned along with Mr. Davis.
I mean, it feels good. I would be lying if I said there weren't some validation there hearing that, because I have worked really hard to do a good job and to do the best that I can, and to establish a reputation and try to live up to that reputation. So yes, I'm honored that I would be mentioned in that light, and I thank you.
Talk to me and elaborate a little bit on why positioning is so important when you're getting these x-rays.
The answer is really simple, and it's very simple, because with poor positioning, you can make good hips look bad, and that right there is just in a nutshell why it's so important. These dogs that we're x-raying, their future depends a lot on how these x-rays turn out. The breeders that are breeding these dogs, a lot of what they're doing depends on how the x-rays turn out. It's just, there's so many things that ride on how those pictures turn out and how they're being judged, that it's paramount to get proper positioning. Hips are the joints that, or the one set of joints that end up carrying a large part of their weight and a large part of their movement. And especially in your big dogs. The bigger the dog, the more important the hips are. The arthritis or degenerative joint disease, which is what happens to these joints that are dysplastic, can cripple a dog. And it can be very, very debilitating to the dogs, and painful to these dogs. So the more that we can do as breeders to try to eliminate dysplasia, the more favors we're going to be doing for the breed down the line. Now, that being said, the genetics of hip dysplasia are very, very, very complicated. It's not just one allele on one gene, on one chromosome. It's multiples of each of those. But by and large, if you are breeding dogs and you have a male and a female that both have good hips, chances are their progeny is going to also have good hips. And it's something that you work to improve on over time. It's not something that you fix in just 1 or 2 generations. It's something that you improve on over time. Bearing in mind that genetic diversity is also very important too. So if you eliminated every dog out of the gene pool that did not have good hips, then you wouldn't be, in some breeds, you would have very little, if nothing left of the gene pool. So you have to make some careful decisions as breeders to, maybe sometimes you don't throw the baby out with the bathwater, but at other times you do need to make some tough decisions where, okay, this one should probably be neutered and placed in a pet home, or just not being used as breeding stock.
One thing that I found out early on is that most vets, they use anesthesia when they're doing the hips and elbows for OFA, but that's something that you don't do. So if you could elaborate a little bit as why is to that.
Okay. Well, number one, that's what we're taught to do. We're taught to do that in school. That the only way to achieve proper positioning is with the use of anesthetic agents, and that's not true. If you work with the dog, you work with the owners, and if the dogs, almost all the dogs that we do are just really well behaved. But if you work with the dogs and work with the owners, then they'll give you what you need to get. You just have to be patient and work with them. I think that I would so much rather do a dog, x-ray a dog that is wide awake, because I think that we end up getting better results with an awake dog than we do with one that is anesthetized or sedated. You have muscle tone. When they're awake, you have muscle tone. And that muscle tone really helps to keep things nice and tight. You don't, if you have any type of laxity within a joint, then when they're asleep, that laxity is going to show up. But if they're awake, you won't see it. So I think we end up getting better results that way. There's another big reason in that a lot of these breeds, man, they can be really, really sensitive to anesthesia. So why risk giving a dog anesthetic agents that when you don't necessarily have to do that? We have a lot of clients with Rotties, wonderful dogs. If you start asking the general public what their opinion is on Rottweilers, then more often than not they're going to be scared of them because they're big dogs. They look mean, but my experience is every dog is a product of their environment, and these dogs are big teddy bears. They're big teddy bears.
That they are.
We We had one in here yesterday named Russell that would fell asleep on the tray. And they're great dogs. I like them. I like them a lot. I can't control whether or not they're good or bad. The only thing I can control is positioning.
Good.
And so my job is going to be to get the absolute best positioning that we possibly can. And to do that, we have to make sure that basically everything's in a straight line. That the spine is in a straight line with the pelvis, and that the femurs are both parallel to each other and to the spine and the pelvis. And that your patellas, right here, there, are towards the middle of the shaft of the femur. And it's really just as simple as that.
How long does the process usually take when you have a dog who's laid up here, you have the owner, and is it like a 15-minute process or something in and out?
It depends on the dog.
Okay.
And like I said, we try to go slow and take what the dog gives us. So some dogs, it can take just one click of the x-ray machine and we get exactly what we want. Some dogs I have to work with a little while, and it may take 10-15 minutes, and it may take 10 or 15 pictures to get what we want.
That's another good point. You continue to take pictures until you get the best picture, correct?
Yes, sir.
That's very important.
Yes, sir.
That's very important. Now, is it possible we can pull up Mack, or you have to someplace?
Yeah. Let's pull them up and see. Okay, there's Mack.
So there's Batman.
That man's got some good hips. That man's got some nice hips.
That's good.
Yeah.
So Batman's looking pretty good. It's lined up how it's supposed to be. And I've heard OFA has been pretty hard on the ratings.
They can be. It really depends on. It's all a matter of opinion, and therein lies the downfall, the pitfall with OFA, because it's all 100% subjective. There's no objective criteria that's consistently that they look for across the board. So,
what's the process for submitting to OFA? There is it's a $40 fee, and there is a form or application you have to fill out and submit it in. Is that pretty much it?
Yeah, that's pretty much it. And then get the x-rays. And then what we do in the digital age, the veterinarians have to send in the form with the picture to OFA. Then it takes about 3 to 4 weeks to get results emailed back to you. We are at Tigertown Animal Hospital in Clemson, South Carolina, 864-624-8824. And we do the OFA images there at the hospital, in addition to being mobile on the road with Blue Ridge Veterinary Imaging. And that number is 864-650-3151.
Thank you for being a part of this. I really appreciate it.
All right. Thank you so much, Mike.